Hello, is it Mr. Johnson?
It is, yes.
Hello.
Hello.
My name's Dr. Alderson.
Oh, hello.
The nurses have asked me to come and have a chat to you about things.
I spoke to this. I really want to go home now because I'm feeling fine now, you know. Had this pain and they give me some medicines and things to take with me. Well, they've given me some medicines so I can take them with me and I can get on home because there's a heck of a lot to do. And, you know, I need to get back to work really.
Okay, so it sounds as though there's quite a lot of things going on at the moment. Should we start really by just talking a bit about what brought you into hospital so I know exactly where everything's up to?
I just had this chest pain.
Okay.
And, you know, it's pretty sharp and I thought, well, you know, this is no good. I'll go to A&E and they decided I needed to be admitted for some tests, you know.
Okay.
But in fact, as I say, they've given me some medication. I'm not quite sure of the aspirin and something, and said something about a bit of high blood pressure, but they're not going to treat it or other.
Okay.
So as far as I can make out, there's nothing really very much. I think it's just one of those things, you know. But I really do need to get back to work.
Okay.
You know.
I understand that it sounds like you've got a lot of things to do and you're very busy.
Yes.
But do you understand what the problem was then that brought you into hospital? I know you said you had some chest pain.
Well, not really, but I mean, you can get these things, can't you? And it's all cleared up, and I'm feeling perfectly normal now. And, you know, what with Christmas coming on, you know, I'm a van driver and deliveries and everything. It's one of the busiest times of the year, you know, and there's overtime potential. And, you know, what with the family and, you know, the kids and Christmas presents and everything. I just need to be getting on with things.
Okay. Well, I understand that, you know, it sounds like you're very busy and you've got lots to do, but I wonder whether we could just talk a little bit about that problem that brought you in and I could perhaps explain to you about what happened, because it sounds as though, you know, there's perhaps been some missing information or that you're not fully sure what's been going on, really.
Well, I mean, nobody's really said very much. They just sort of said that, you know, they were going to do some tests and, you know, all sorts of scan things and what have you. I'm not quite sure what half of them were for. But in fact, they didn't really say, they just sort of said, well, they just did the tests and they put me on medication, really.
Okay.
But it's done the trick. It's done the trick.
You can often be given quite a lot of information in hospital and a lot of different things can happen.
Yeah.
It's be quite difficult to know exactly what's going on all the time.
Yes,
But you said you came in with some chest pain.
Yes.
And they've obviously done quite a lot of tests, some scans and some heart traces, some blood tests.
Yes.
And those actually showed as though there was a heart problem that you had. Were you
nobody said that at all.
Okay.
I mean, is it serious?
Well, potentially. I mean, it sounds as though you've had some treatment already.
I have, yes, I'm feeling fine.
Yeah, but the tests actually showed that you had a heart attack when you came into hospital.
Oh, surely not, because I mean, heart attacks are very serious, aren't they? I mean, I was feeling pain, but I mean, I wouldn't say a heart attack at all. Can you say that's what it is?
Yeah, that's what the test showed. So the pain that you had was coming from your heart. And
right, okay, well I could sort of understand that because it was that sort of area, but I mean it's all cleared up now. I mean they've obviously got it in time. I mean surely I'm okay now though, aren't I?
Well, as you say, you know, they were able to treat things very promptly and they've started you on some of the right treatment. But what we want to do is to make sure that we treat you properly and that we give you all the treatment and all the tests that you need. And you have been started on some medications, that's right, and those are medications that you need to continue to take, those tablets that you've told me about.
Right, okay.
But there are also one or two other tests that need to be done before you...
Oh, so you've not finished with tests and things?
No.
Well, I mean, how long is this going to go on for? Because like I said, I don't want things to go on too long because I'm feeling okay and, you know, I'm quite sure... You know, now I know what the date it is, I could, you know, come back more quickly if it happened again, but who knows, it might not happen again.
Well, I understand that, but, you know, we need to make sure that there's not, you know, any problem that we need to fix before you go home, really. So we need to make sure that... and let me just start that bit again. You'll have to edit this out. I started talking rubbish. Arguably I was all along. there are some more tests and things that we need to do, because really we need to make sure that this isn't a problem that you're going to have again. And what we really don't want to do is to let you home from hospital too quickly and for you to go out and get more pain and end up in a serious situation.
So you're saying you want to do some more tests,
yeah,
and then when you've done those, you should be able to fix it all, and then I should be okay to go home and carry on.
Yeah, so we want to do some more tests really to find out if there's anything we need to, any sort of intervention, if you like, or anything we need to do to stop this problem from happening again.
When you say an intervention, what does that mean? I mean, you're not talking about an operation or something, no? Bypasses, do they call them?
Yeah,
You're not talking about anything like that?
Well, I don't know for a start, because it depends really on further tests and what we find. Some people who have a heart attack and, you know, they're just on medications afterwards. Other people, we can do a test called an angiogram. I don't know whether you've ever heard of that test.
No. But it's a test anyhow.
So that's a special test to look at the blood vessels that supply the heart with blood.
Right.
And if there's some furring up or some narrowing in those blood vessels, sometimes that needs correcting.
Yeah.
And that can sometimes be done with little things called stents, so little tubes to open them up. And sometimes with, like you mentioned, with the bypass. So
this all sounds as if it's going to take an awful long time, doesn't it, though? Because, you know, I mean, I've got a wife and 2 kids and everything, and, you know, I'm the breadwinner.
Yeah.
You know, I'm paying the mortgage and the bills, and, you know, it's cost of living's going up and Christmas and everything. You know, I mean, I can't spend too long on all of this. I mean, is it all necessary? I mean, like I said, I'm feeling okay.
Yeah, and it's good that you're feeling okay now, and I understand that you've got a lot of important things to attend to, but really we need to make sure that we've done our bit and that we've made you as well as we can before letting you out of hospital.
Well, yes, that's okay, but I mean, how long are we talking about all of these things?
I would have thought, I mean, normally after a heart problem we'd keep people in hospital around about 5 days. We need to make sure that we've done all the investigations and given you the treatment you need. And also we need to make sure that you're well enough to go home, that you're not having any symptoms when you're sort of walking about or those sorts of things. And we also have this thing called cardiac rehabilitation, which is sort of run by some of our nurses and our physiotherapists, and it's a way of making sure that, you know, that we've addressed all the problems, and that you know, we don't lose contact with you when you go home, that we make sure that you're getting back to your normal activities, and that you're not getting any symptoms really.
I mean, if I go home now, which, you know, I mean, you sort of said 5 days, but that amounts up to a lot of money in my terms, you know, because I've paid on the hour, you know. That's a long time, and that's a lot of money. That's the thing. I mean, if I went home and took the medication, they'd give me a pile of things. I'm not sure what some of them are for, but if I made sure I took those, don't you think I'd be okay to see if anything happened again, you know, and carry on with the job? I mean, I'm presumably okay driving.
Okay, so we'll come to the driving in a moment, but to address the sort of first part of your question, the medications are important. You're right that you do need to continue
I would take
them.
those. Yes, I would take
But
them.
until we've done all the tests and made sure you're well enough to go home, the problem is that you might have this sort of problem again if you were to go home too soon and have another heart pain and another heart attack. And my real worry would be is that it could be more serious next time.
So you think there could be another one, and you think it really could be... I mean, a heart attack could... Well, I mean, it could finish me off, couldn't it?
And that's why we really need to make sure that we've done all the investigations we need to do, and that we've made sure that, you know, we've got a good treatment plan in place, and that you're well enough to go home, because we don't want that to happen. No. I'll
have to have a think about that one, because, you know, like you said, I don't want, you know, I don't want another heart attack or anything.
No. And I'm by no means saying that that's what would happen. I'm just saying that that's a risk, and we need to make sure that we that we don't expose you to that.
And if you do some more tests, then you'll know a bit more
exactly
what's going on. Yeah, I
you'll
see.
be able to make a plan for for your treatment, and also make sure you're in contact with this cardiac rehabilitation program, so that you can get back to things properly and safely. Really,
I mean, the heart attack I've already had, let alone one in the future. I mean, this doesn't mess the driving job up, does it?
Well, it does a bit. Do you what sort of driving do you do? Do you drive for a living? Did you say?
Yeah. It's transit.
Okay.
Transit van.
So is that just a normal sort of licence you hold, or is it's not an HGV one? Okay. There are actually some sort of important rules and regulations in place regarding driving after you've had a heart problem.
Right.
And that's something that I need to make you aware of, really.
Oh no. Yes. Okay.
Yeah. So the DVLA that governs driving has rules about medical conditions.
Yeah.
And they say that after you've had a heart attack, so regardless of any extra treatment you might receive, you're not allowed to drive for 4 weeks.
So I can't drive in any case?
No.
So I might as well stay here and have the other tests. What am I going to do about the family though? I mean, I don't know any sick pay or anything, and I don't know what I'm going to do about that though. And you say, and if I did try and drive in that time, I'd presumably lose my licence, wouldn't I?
So when you have a medical problem, you have to tell the DVLA that you've had that problem, so that they know that what's been happening.
Yeah.
If you were to drive, in a period when you're excluded for a medical condition, then you would invalidate your insurance for a start. And
this gets worse.
Yeah. So it's really something that you can't do. You really have to stick to those rules, I'm afraid. And as I say, they are the DVLA's rules. They're not our rules. That's it's the law, if you like. Now you did mention that you were worried about sort of the pay and sick pay and all those sorts of things.
Well, yeah. I mean, I know a heart condition is serious, and obviously, it could put pain to a lot of things. But I mean, the immediate concern is literally, like I say, literally paying the bills when things are very balanced financially. Any loss of income.
Yeah. So I understand that that's obviously a big concern.
Yeah.
The best thing that we can do is to get one of our nurses to contact the social team really for you, the social worker, and they can help you with those sorts of things.
Can they sort of do financial help? I mean, that's the main thing, the financial help.
So they can direct you towards the sort of the right places to find out the information you need, and if it is a case of just having a sick note and things, that's something ourselves, and then also your GP can sort out once you've gone home. But if it's about access to sort of benefits and all those sorts of extra things, then they can certainly help direct you in the right direction.
I have to see what I'm certainly going to need them. But I seem to be really caught here, don't I? But
I mean, the main priority is really your health, and without that, then.
Yeah, well, I mean, I suppose, yes, that's right. I mean, okay, we'll perhaps just have to try and manage for the time being and see how things work out.
But there's certainly lots of help available for the work and the financial side of it. And although I'm perhaps not the best person to advise, it's not something I'm specialised in.
No.
Certainly our nurse and our social workers can point you in the right direction to get the sort of, to access the help and assistance that you need with that.
Okay then, well in that case I suppose I'll have to stay and see what they tests and where we go with there, and as I say, if you could get these other people involved as soon as possible, and then I can tell the wife how things are going to work out, and hopefully try and reassure her a little bit on the financial front.
Yeah, and I'm sure they would be happy to meet with both you and your wife if that was helpful, and that's something that you can
I'll think about it. Okay then, well I'll stop, and
okay, good.
Yeah.
I'm glad to hear that. I think it's important to get you fully well before we send you home, and I don't think it'll be too long until all those tests are done. Perhaps just another few days, and then you'll be able to go home. But we want to see.
Well, at least I can go home, but I won't be able to drive, would I? So the main problem is still anyhow. We'll just have to take things as they come, won't we? Yeah. All right then.
So,
okay, well, thanks for seeing me then.
Okay, it's my pleasure. Is there anything else you sort of wanted to ask me while?
No, I don't think so. No, I think we're okay.
Good. Well, if you do think of anything, the nurses can contact me. That's no problem.
Okay.
All right.
Thank you.
Thank you very much.
Thank you.
Okay, Helen, thanks very much. Could you just quickly summarise what you discussed there for me?
The gentleman wanted to self-discharge from hospital, so I explained to him about the fact that he'd had a myocardial infarction and the implications of not having full investigation and treatment after that, so that he could potentially have another or have further health problems, and then explored really the reasons as to why he wanted to go home, and found that was because of work pressures.
Okay.
And so addressed how we might help him to resolve that, and in seeing the importance of being treated for his medical problem, and the fact that we might be able to help him with some of the social issues, he agreed to stay in hospital.
Okay. So you think you reached a satisfactory conclusion there?
I think so, yes.
Great. And which of the 4 ethical principles do you think was most important in your discussion?
Well, I think there's elements of them all in it, but one of the most important things really was autonomy. So respecting someone's right to make decisions about their own health and management and treatment for themselves, really.
Okay.
And the principle of autonomy really hinges on that being an informed decision, so a patient having all the information available to them to be able to make that. And in this case, the gentleman didn't really understand what the underlying problem was, of the fact that he'd had a myocardial infarction, and didn't really understand the potential consequences of leaving that, not fully treated and of going home too early. And so once he'd understood that, then he was able to arrive at a different decision. So I think it highlights a principle, but really an important underpinning of that, which is the patient's understanding of all the things that affect it.
Okay, great. And finally, you discussed driving and the fact that he was going to be excluded from driving for a period of time. He was very understanding. If he'd have challenged things further, you mentioned his insurance may not be valid. If you believed he was going to continue to drive, how would you have handled that?
Well, then in that case, I think I would have sort of told him that, reiterated the fact that it was the DVLA regulations and that he should inform the DVLA, and if he was still insistent, then it comes to a point where there's actually a potential danger to himself and also to the wider public if he was to have a heart attack while he was driving the car. And so in that case, I would inform him that I would be duty bound to inform the DVLA on his behalf that he shouldn't be driving. I would hope, if that was the case, that he would then rescind that decision and inform me that he wasn't going to drive. But clearly, if he still insisted, then I would have to go ahead and do that.
Okay, thank you very much. The most important part of this scenario is recognising that both the patient and the doctor may have a different agenda. Here the patient was desperate to go home so he could continue working, but the doctor wanted to ensure he'd stay in hospital, receive the best treatment and make sure he was addressing all of his legal responsibilities regarding driving. As discussed after the scenario, this is an autonomous decision-making process, and the most important part is imparting information. This should be done in a way that the patient becomes more informed as opposed to feeling scared and pressured into doing this.